Ectopic pregnancy refers to the implantation and the development of a fertilized egg outside of the uterus, which can lead to serious medical complications. The fertilized egg may implant in various locations, such as the fallopian tube, ovary, cervix, or even outside the reproductive system. But the most common location is the fallopian tube. Ectopic pregnancy is the leading cause of death in the first trimester. This is because the symptoms can easily be mistaken for those of a normal pregnancy. Many women experience an abdominal pain, vaginal bleeding, and other common pregnancy symptoms, which can delay the diagnosis. Therefore, it is important for women to seek medical attention if they experience any unusual symptoms during pregnancy. An ectopic pregnancy is a surgical emergency. If left untreated, it can cause a life-threatening internal bleeding. Additionally, it can cause damage to the fallopian tubes, leading to infertility. Therefore, early detection and prompt treatment are essential for a positive outcome. There are several risk factors associated with ectopic pregnancy, including women who have had pelvic infections such as gonorrhea or chlamydia due to the scarring that this infection can cause in the fallopian tubes. Previous surgery on the reproductive system can also increase the risk, and there are certain types of contraceptions such as intrauterine devices and oral contraceptives which can also be associated with an increased risk. Lastly, age is a risk factor, as the risk increases with age. In terms of diagnosis, there are several signs that may indicate an ectopic pregnancy. The first thing is pain, associated or not with uterine bleeding. A physical examination may reveal a painful and tender abdomen, while gynecological exam may reveal a purplish cervix with a bleeding from the undercervix. Paraclinical testing such as measuring plasma BHCG levels and using an ultrasound can help confirm the diagnosis. In terms of treatment, ectopic pregnancy requires an immediate intervention. Depending on the severity, treatment may involve resuscitation measures and surgical intervention or medical treatment. Surgical treatment can be performed laparoscopically. In some cases, conventional surgery might be necessary. Medical treatment with methotrexate may be indicated for certain cases, but it is so rare due to the late diagnosis. Finally, prevention plays a huge role, such as prevention of sexually transmitted infections can help reduce the risk of ectopic pregnancy. Thanks for watching.